One of the defining aspects of this process was that we really tried to look at how do you create value for all stakeholders involved. From a patient perspective, we wanted to make sure patients were getting the best devices, the longest lasting devices, give them access to new technology, things like remote device monitoring. And we got that from actually talking to patients. We had patients within the process telling us what mattered to them. One of the things we heard from patients is the pain and difficulty of having to have multiple replacements over their lifespan, and they identified a want and a need to actually minimize those. We also knew from other jurisdictions that longevity was something that they had placed as a priority, and actually had recommended that that be the basis for the evaluation of these devices. What we recognized was that a $4,000 device that lasts 4 years in a traditional procurement would normally do better than an $8,000 device that lasts 8 years. What we wanted to do is really look at it as opposed to a budget cycle, so a 1-year view or even a 2-year view, a patient life cycle view, to really be able to put patients at the center of this process. We then looked obviously at hospitals and physicians, making sure that they had access to what they needed, where they needed it, that they could balance some of the financial challenges that hospitals have across their cardiac portfolio, and making sure that we had equity of service and warranties, that it didn't matter if you were a patient in downtown Toronto or Sudbury or Thunder Bay or Ottawa or Windsor, it doesn't matter where you were, there was a certain standard of doing business in Ontario. The other element of value that we really tried to focus on was also for the vendors. We wanted to make sure that we were writing an RFP and creating a process where they had input up front and ongoing into the process, that their ideas could be brought forward, and that we were really giving them a chance to showcase their innovation, to showcase how they could make a difference for patients.
The single thing that is most important in determining a successful value-based procurement initiative is having a very clear objective and a very clear question. In the case of ICD devices, we really focused on where there seemed to be the greatest differentiation between different products, and that was how long they lasted. And this is really important because how long a device lasts dictates how often a patient needs to go in for a surgery to have a device replaced. The methodology we employed was a total cost of ownership analysis, where we took every single device and focused partly on the cost of the initial procurement of the device to implant it de novo. But more importantly, we combined that data with data on how long these devices last and how long patients live to get a holistic view of what cost the system would incur to treat these patients.
Our multi-stage process involved ensuring that everybody that bid, products were qualified and met the needs of the patients, and pricing was within a certain band. And so as long as your products, from a cost perspective and a quality perspective, met the needs of the patients and the providers, at the end of the day, you were included in the process. So we ended up with a very good result by ensuring that all competitive products that were meeting certain standards within a certain price range were available to the providers at the end of the day to ensure the patients got the products they needed.